So recording's going. Okay, so we're good. All right, we'll get started. Welcome everybody. I'm excited about today. I think this is going to be very insightful because today we're going to learn about, I think, the foundation of where this technology first began by the innovator that developed it. So real quick introduction. I think dentistry today is entering an era where what we can't see can cost our patients. You know, one of the biggest things is trying to locate the disease. That's what one of the important parts of, I think, the radiographs that we've become accustomed to. But today with this technology, we can actually see early demineralization, the biofilm activity, where inflammation is most likely to occur. We can see where there's failing margins around our restorations. We can see where the biofilm is around implants. And those can all become obvious problems. So today I'm joined by Dr. Albert de Jocelyn de Jong. I know that's a very difficult name for me, Miyazaki, but we'll call him Dr. Albert just to keep this easier. He was a developer of the QLF biofluorescence technology. And I think that's one of the most important breakthroughs in making invisible issues visible in everyday clinical dentistry. And as we've gone through the last few programs, we've been trying to illuminate that and show how easy this technology is to integrate in everyday clinical dentistry, but how valuable it is, both to the practices that implement this technology and to the patients. To the practices, we're able to show the patients something that's very clear and visual so they can see the problems that we're trying to address. And then for the patients, if we can capture these images and show them so that they can make the decision to treat these issues before they get bigger, I think they benefit from that too. So today what we're going to talk about is the innovator of this technology, how it's come about. It's going to be really interesting. We can talk also about the real world workflows and how this AIOBIO's QBLISS that has implemented this QLF technology has turned this into a wonderful modern day early detection and patient motivation system that we haven't had. It makes our education of our patients more effective, makes it faster. And again, that's what benefits our patients and ourselves. So Dr. Albert, let me do real quick. I have a quick bio because it is a privilege to introduce you, one of the true visionaries behind modern fluorescence-based dental diagnostics. And I know you've got your physics degree, you've got a PhD. And in this intro, I wanted to keep it kind of more relevant to those of us who are clinicians. But as the inventor of QLF, or quantitative light influenced fluorescence, you've really helped to, I think, open an entirely new window into what we as clinicians can see, what we can then measure, as Dr. Yoon has described, and then monitor oral health. And I think this can change the way we practice dentistry. Your work has profoundly influenced the way dentistry can approach with early detection, prevention, and then what I'm really excited about is the minimally invasive care that we can provide our patients. And then by making the biofilm and the enamel changes, as Dr. Kim has shown us before, and other subtle oral findings more visible and clinically meaningful, your innovations have really helped dentistry towards, I think, that more proactive approach. And, you know, it's based on science. And I think that's one of the valuable parts. So you yourself, you bring together, I think, a rare combination of the deep scientific expertise. You work with clinicians, you work with the University, Yonsei University in Korea. You work with the students there helping to do research. And then you're developing this practical innovation. And I think you will have a lasting impact, you know, in dentistry. I think all the doctors we do these interviews with all will have that impact. But your contributions will continue to shape the technologies and the philosophies that are redefining how we diagnose, communicate, and care for our patients. So I just really want to thank you for joining us. And I don't want to be too long-winded, but I think you really deserve all the accolades.
No,
People appreciate you.
well, that's very kind of you. Yeah, that's a long introduction to me. I appreciate the way you pronounce my last name, de Jocelyn de Jong, which is correct. I'm partially Dutch and partially French. Well, I think I'm 99% Dutch, but my pre-ancestry came from France. They were Huguenots, and they came from a place called Josselin. There's the big name Josselin coming from. My father was a hardcore scientist. He had equations. So he had one equation was 25 pages long, and nobody understood what he was doing. So he was very clever. He became professor in Delft. He calculated water flows through dikes to prevent water from coming in from the sea to the Netherlands. He was quite famous, but nobody understood what he was saying. So he just spoke in equations. So there was one, he went to Israel one time and he calculated the Dead Sea something. And then he gave this bunch of equations to the prime minister at that time. And then the prime minister said what to do with it. Well, my dad said, just read it and do what you need to do. So that is one of the things which brought me to do something practical. So I like to do the hardcore things, but what my father lacked to do was to bring the comprehension to the people. So I want to do things which are quite difficult, but it only works if I can sell it. So that's why I started a company. My father was aghast about that. He said, well, you should go to the university. You should do not, you should work for the public, not to earn money. I said, well, what are you doing? You're earning money with writing equations, which nobody can understand. Yeah, I said, that's a good thing, but okay. So I started this company, but in heart, I'm a scientist. So that's the reason I work with Professor Kim at Yonsei University. I am very happy there because there I can use my expertise to educate and to work with young students, which keeps me young, by the way. And it also gives a feedback how to change my thoughts. So I need young people, I need people from the clinical field to tell me, is this the right direction? So it's like walking in a maze. My life is like walking in a maze. So you never know so where you're going to. You have to investigate everything, every path, every way. And then sometimes you find a way unexpectedly, which leads you to the light. So that unexpected thing led me to fluorescence. And fluorescence was actually, just an accident. I'm very visual. I like visual stuff. I was working with X-rays, and I came in touch with a Swedish guy, Volker Sundström, and he was a dentist in the Karolinska Institute in Stockholm, in Sweden. And in 1981, when I was a very young PhD student at dentistry at that time, I visited him, and he had a laser like 3 meters long, and that was a 470 nanometer laser, and he could put holes in doors. Actually, I by accident I left that laser later on, and I burned that hole in that door. So with that laser, but he could project that laser on a tooth of a patient, and then I suddenly saw a white spot very clearly as a dark spot. So then I went to this guy, Volker Sundström, and said, I would like to work with you. When I finish my PhD, I would like to develop your system, and maybe we can make a system which can be used in the mouth. So that's how it all started. And that was 1981. Yeah, a long time ago.
Yeah, 1981. So when you were doing that, was that that you wouldn't classify that yet as QLF? That was just looking at light interaction with different dental surfaces.
He called it laser fluorescence.
Okay.
But but laser at that time, everybody was very scared of laser. Well, actually, they are very dangerous. But so they didn't. So I didn't want to put that name. So we called it. Let me see. Yeah, that was 1988 when I just started my company. I visited Birgit Anger-Mansarn, who was the professor at that time, and Volker Sundström. And then we started to develop a system, and we called it quantitative laser-induced fluorescence.
Mm.
That was QLF. And we coined, so that was coined in 1988, and it was presented in Dresden, I remember, at the Orca in 92. But anyway, we dropped the name laser, and we said light, because later on we used the car lamp, and now we use little LEDs.
Hmm. So you went from was it accidental, or were you trying to identify biofilm, or were you working with the light first and found out that they could identify the biofilm?
Well, that was by accident, actually. So we were focused on the white spot, and we just we made a paper and showed that if you have bracketed patients, debracketed patients, that the white spots made by those brackets would disappear after a year. And we could measure that. So that is actually what we presented at 1992. So that was only white spots. We didn't know anything about biofilm. So then there was this Professor Stuckey in Indiana, and he said, well, Guy, he said, that's very interesting. He was a kind of a cowboy, actually. So we started to work together, and he said, well, your system is not useful. Please make it so I can use it in the clinic. So we made a system which was based on a car lamp, on a Mercedes arc lamp, which could be producing blue light. And that blue light was a bit different than the light from the laser. So it afterwards it appeared it had a peak at 405 nanometers, which is exactly the peak to excite porphyrins in biofilm. But we didn't know that, so we used it in the clinical trial. So there was this clinical trial in one dreadful place in Indiana, where there was a lot of carriers and a lot of poor people. And there, the PI called me from the United States to the Netherlands, very expensive call, and she said, "I think your system is broken," or she says, we see something very interesting. What happened was that she saw red blobs in the images, and she said, or it is a mirror which is broken, or we see something which we didn't see before. And 2 weeks later, she called, she said, hey, all those patients with red have a lot of carriers. So maybe that's got something to do with biofilm. So that's how it started. And then I optimized the system, so I fiddled around with filters and lights and stuff. Took about 5 years to get the filter system, which we have right now, and which is sold successfully by AIOBIO at this moment. So that's how it started.
Yeah, that's a great story. You should tell that story more. I mean, it's interesting that that's the way it developed. So when they first saw that, they saw the red, and now you've kind of created a commercial piece of equipment to do the same thing. Have you seen the response of clinicians change over the last 30 years since you first had introduced this?
Well, the reaction is diverse. So some people, they say, well, I can see it by my eyes. Why should I use this? There are other ones who are really excited by it. There's two parts of it. The reflection actually is gone. So you see something else. And you see things which you normally don't see. And some dentists really are excited by that. One of those dentists is Dr. Jung. I don't know if you know him. He's sitting right there, right here. The other one who was very excited was Professor Kim, who I met. When was that, Bagil? Was that in 2007?
Yes, maybe.
Wow.
So we met in Indiana, and we had this prototype standing there, and we had a lot of dentists there, and it's 50-50. So 50% of the dentists are not interested, because it's unknown. It's they have been working around with their own eyes. They know what they're seeing, and they claim to have seen it all. There are other dentists, they think in a different way. They say, hey, this is something new. Is there a proximal caries, for example? Can you see at that time? We couldn't see that, but Professor Kim, I'm quite sure he already thought it in his head. Maybe we can do that with that system. So we developed it together to get to this stage. So being the inventor is very nice, but you can only do it with other people. If you cannot work with other people, then you cannot do anything else.
Yeah, I understand what you're saying. When we started using the technology at first, I don't think I appreciated it as much because I didn't really understand what it was, the value of it. And today, we want to use it every day just because it helps us identify areas and diagnose.
Could you elaborate on that? Could you elaborate on why? So you saw it in the first point. So what was your thoughts about that?
Yeah, I think when I first saw it, with the intro camera, the pen, I think I thought of it more as like an intro camera, maybe just another intro camera. I think the big Q cam, the bigger camera, I think I thought, well, because I use my DSLR all day long taking pictures of patients and some of the work. So I thought of it maybe as just a redundancy, just something like we already had. And then once, it's one of those things where many of us will get equipment and we'll order it and we'll get the box and we're excited to have ordered it and get the box, but then we never take the time to hook it up and use it. And so once we started to use it, I really liked it. My daughter, my associate, she liked it. And then, it's always hardest to, I think, get your hygienist. Not everyone's like Kristen. So, it's like, okay, now I got to get the team to use it. But, when we got both of our hygienists using it, it was very easy. I mean, they both really liked it. And, one of our hygienists doesn't like a lot of change. And so we thought, well, maybe this isn't going to work with that hygienist. But that hygienist has been doing a great job, taking a lot of images and showing the patients before and after they clean up the biofilm. So it's really helped. And patients look at it. One, I think there's, in our practice, we have patients that have been in our practice for 60 years. And so when they come back to the practice and you're just doing the same thing over and over, I think it's actually easier for them to hear what somebody else's dentist is doing that sounds kind of new. And so you risk losing those patients. But in our practice, we're always trying to update our technology. And so when we have something new that's very easy for our patients to understand, they get excited about that. And I like that because when they're excited, then they view us as staying up on our technology and our education and trying to provide them with the very best, which is what we're trying to do. And it really helps to build more value, I think, in the value of our practice and what we do. So I think it's just like everybody else. When you are looking to make change, even if you see the value of that change, in dentistry, it doesn't even have to be technology. It could be changing the material used as our filling material or, an impression material or technique that we use. And somebody says, well, that's fine, but there's a better way. And they show us how to do this or how to use the material. We get excited about it. But as you know, the hardest thing is to change someone's true behavior, and so I think that was just my shortcoming at the time, but it just took somebody to show me, like what we're trying to do during these recordings, is show me the value of what I could provide for both myself and my patients. And then you're like, okay, this is what I have to use. So that, in the introduction, I said, I think you have the ability by what you've already done and what Dr. Yoon has done and Dr. Kim has done is to really change dentistry. And so when I go out and talk to my colleagues, I say, one of the things that we have to get away from is waiting so long that when we take our bite wing x-ray, our radiographs, that we can see the decay. Because if it were my child with, healthy teeth, I don't want to wait till they have a hole in their tooth. I want to be able to see where those holes are most likely to occur. Maybe they don't have good hygiene habits, or maybe they're just collecting a lot of biofilm in a certain area, where I can tell the patients now, okay, let's treat that to prevent disease from happening. Let's not let that hole develop. And then, one of the things that, from a research position, developing those long 25-page equations like your brain works. And then we have to go and, practically apply this. And I think one of the things that we're really excited about, and we'll talk more about this in upcoming programs, is that with the abilities that you've given us, we can detect where the bacteria is. And that bacteria, if it's by the gum, is probably most likely to cause gum disease. And if it's in between the teeth or around orthobrackets, we're going to get white spot lesions or cavities. And what Dr. Yoon and AIOBIO will do next is we're going to be able to, what I'm calling chemotherapeutics. So if we identify where that biofilm is, well, how can we treat that when patients don't brush and floss well? Well, there's different chemotherapeutics we can put on the patient's teeth that will help to break that biofilm down around the gum line and even underneath the gums in the sulcus. And then, okay, now we got those white spot lesions that could occur, but we can see with the white or with the red glow where those white spot lesions are most likely to occur. And before those occur, we use one chemotherapy to remove the biofilm and then another to strengthen the tooth back up. And I think that's going to be the exciting part. What people are now talking about is when you have young kids, we've always kind of accepted that as kids, they were going to get cavities at some point. And now we're talking about the possibility of our kids never having cavities or gum disease as they grow up. And I think, the fact that you, Dr. Yoon, Dr. Kim are bringing all these things to our colleagues where we see this and we see the possibilities, I think that's where, again, when I did your introduction and I talked about the impact you could have on our profession, even not being a dentist, this is what I'm talking about now.
Just another question. I know I'm supposed to be questioned, but more interested. But I'm more interested in your clinical practice. Did QLF or QRay change, or QBLISS, whatever you call it, did it change your practice in a way?
Yeah.
So could you put it into your workflow? That is actually a question.
Yeah, and that's where it fits so easily into the workflow. Start off, just our workflow is we use the camera, the Q-cam, which is the larger field view, so we can get smiles, lateral views like you would with your digital camera. So when our patients come in for their initial examination, let's start there, a new patient comes in, we take photos of their smile, but we're using the Q-cam because we get both the white light photograph that we want to use to analyze their smile, but then we also get the biofilm, the red light photo where we can show the patients where the biofilm is. And then I have those up on our monitor, just like you would for a new patient exam, so the patients can really appreciate both the smile and what the red is showing them. And then we do our exam, and we do the exam, we walk the patient through, but now with the intraoral camera. And I think what the listeners have to understand is we don't take two separate photos, but when I hit the button on either the Q-cam or the intraoral pen camera, we get both images. We get the white light image and we get the red light image, all with that push. And so we can bring that up, and then over time, again, using the AI technology that AIOBIO has developed, you can then do the comparisons, right? And I think that's the important part. Is it's always hard to tell patients, I don't think you brush or floss as well this time as you did 6 months ago. And patients go, well, in their mind, I think they're thinking, well, how would you know? It's such a subtle change. And then what AIOBIO's brought is the ability to pull up the LinkedIn's app and show the patients, well, here's where you were 6 months ago, and here's where you are today, and look how there's more red today than there was 6 months ago. And the patients, their cover's kind of blown, right? Because now we have proof that we can quantify that their hygiene's maybe not as good. And so I think this just opens up a whole new field in dentistry, and the way we communicate to the patients, the way we motivate the patients. And then by using—
How about talking to the parents?
Oh,
do you talk to?
Yeah. So you're absolutely right. If you're dealing with a young child, again, the nice thing about this technology is being light-based. You're not poking or prodding the patient, right? You're not having to put a sharp explorer in the mouth or a periodontal probe. You're just using a camera that's just light, and now you're able to show them the teeth with the white light image and with the biofluorescence image, and communicate that to the patient and their parents at the same time. And yeah, I've had patients that have come in that had large areas of decay. And using the biofluorescence photos, I'm able to show the parents before we even begin work that, oh, this looks like it might be a big job, because if you look at the biofluorescence, it just glows throughout the entire tooth, which means even though there's a little hole in the outside, once we get into that, that tooth, there's a good chance that that decay is going to just, be very large inside the tooth. And so, it helps me to prepare both the patients and the parents. Sometimes they look at a tooth and maybe it's just a little dark hole in the tooth, and I think, oh, it's just going to be something small. But no, with the biofluorescence imaging, we can show them that once we get in there, it's probably going to be a large hole. And I think that's valuable.
You know what? You're talking about the dream I had like 30 years ago. That was my dream. That you could understand what you were doing. So I'm one of those patients who wants to understand what's going on.
Mm-hmm.
So I don't want to have a dentist just say, sit still and hold your mouth, and this is going to be short or painful. No, I want to be explained about what they're going to do. So one of the reasons why I developed it was that I had bad teeth. I wanted to know what the dentist saw and what his conclusions were, so I could think with him, because I could supply him with information he wouldn't know. He knew I wouldn't brush, but that's the thing I knew as well. But that was the reason why I wanted to make this system, because I wanted to get rid of the pain.
Mm-hmm.
So if the dentist said, well, I see here a little anomaly here, I'm not sure what it is, let's follow it in time. I really appreciate that. So that's how I go to a doctor in general. So he explains, and that the profession as it is right now in the Netherlands certainly is just sit in the chair and hold your mouth, or open it, not hold it, open it, and I will drill. That's it.
Mm-hmm.
So with the change of the oral hygienist, I think the oral hygienist is also very, very important. Especially if they're young and beautiful. That is my preference. But then they clean your mouth, and then you feel clean again. And if they then explain about all your small anomalies which they can find, and if you can do something about it, that's the dream. That was the dream 30 years ago, sir.
Well, as of today, wherever morning or night that people are watching or listening to this, I want to let you know that your dream has come true. So, miracles happen. And I think you have changed that. We are now able to communicate better with our patients. And I think another thing that's changed, I've been practicing almost 40 years now. And 40 years ago, if I had walked into the room and I told the patient, you've got a cavity, we need to take care of that, they would say, okay, when do you want me to come back? Today, with the advent of social media and YouTube and Google and everything like that, everyone's a doctor at home. And so when you say there's an issue, I think you still have to acquire their trust. And I think today it's harder to acquire their trust because there's so much misinformation out there. But when you can show them visually, this is where we're concerned about. This is the red is bacteria in that area. That's what we're concerned about. It really helps you create that connection and that trust. And that, I think, is what drives success in the practice, every day, every minute. So you've helped us. You've helped, Kristen is the hygienist that you want. And we appreciate
Kristen.
Yeah. We had a good time with her.
Hi. Oh my gosh. I
Hello,
miss you
Kristen.
guys.
Wow,
Yes, I love
you too.
everything you guys are saying. And I just recently got there's a new stat out from Pearl for their AI, and it says 71% of patients will accept something that they can see.
Wow.
Over the trust of just the dentist telling them.
Yeah.
And so 71%, that's the new thing, is if they can see it for themselves. And so I'm excited. I love this product.
Yeah.
Thank you, Kristen.
Yeah. But I think that's where we've gone. And I think you're absolutely right. You've developed the technology that's been refined now to be very practical in our clinical workflow, whether you're the hygienist or or the dentist. And like I was saying, in our practice, our assistants are often the ones using this technology even more than I. So the entire team is on board. And then when it comes down to the our front desk, you think, well, how's the front desk get involved with that? Well, you know, in the US, if we were having to file things with insurance, it's nice to have the images and show both the white light and the biofluorescence images. So, you know, that's your dream has come true. And yeah, we thank you for helping us in this dental industry.
No, I dream further. There's more to dream of.
What's the
There's
next
more.
vision? What's the next vision?
The next vision is that if you come into the office, you make your image by yourself, and you will go to the dental's chair and discuss your own mouth with the general profession.
Yeah,
that's it. And you take everything home. Well, Dr. Yoon is working on that, so maybe the dream will come true in 1 year. I'm not sure.
yeah.
But still, a lot to dream. A lot of things to be done.
No, that's great. You know what I'm going to do is, you know, a half hour with you just goes by too fast. But I'm going to kind of do the wrap up, and then if we have any kind of Q&A or if anybody wants to stay on, we can do that. But Dr. Albert, I just wanted to thank you very much for your time and the insights. I always appreciate learning the backstory of some of the things that I use, whether it be a material or technology. And I think this was really enlightening that you had this vision, and, you know, unfortunately, sometimes visions don't come to fruition overnight, but over these decades of your work and with the work that Dr. Kim and Dr. Yoon are doing, and then through the team like Kristen pushing it with education through the dental hygienist, I think we can all agree that you have made a profound impact on our profession. And I think another part of this where you've been successful is you will change the way that patients are treated, and, you know, they will avoid the pain that you were discussing as a young child. You had a lot of dental work and you really wanted to make it possible for others to avoid that type of discomfort. And I think you really have done.
My children have no caries at all.
Yeah, no, that's great. So, you know, I think this is really what QBLISS is really about, is not just imaging, but just creating a repeatable and a motivational way of communication. It's very easy to incorporate into our everyday clinical workflow. Nothing really has to change. And I think with the AI technology, it's helping to standardize so we can compare visit to visit. And I know, you know, when I watch Dr. Yoon work, he's really quick at pulling up the images and doing the side-by-side comparisons. And so I really would encourage everybody to continue to learn more about QBLISS, the system, and keep track of what AIOBIO is doing, because that technology has continued to be refined. And as it's refined, not only does it become easier to use, but it's going to become much more valuable to each and every practice. And so I really want to thank everybody who had the time to tune in and listen to this. Dr. Albert, great insights. I'm glad it didn't take a 25-page equation to explain this to everybody today.
Me too, to be honest.
Yeah. And Dr. Yoon and Dr. Kim and everybody, Kristen, thank you very much for being here. And we look forward to seeing everybody next month. So thank you very much.
Bye-bye.
Yep. Okay. Bye-bye. Thank you very much.
Thank you.
Yeah.